been offered a job as a researcher with Ronald Goldman in education at La Trobe, and I look back at it now and I think, I can't believe I turned that down for the possibility of working as a researcher in the Peter MacCallum hospital, cancer hospital. But at that time, there was a social worker there who was very interested in sociology and sociological ideas, and I could see that I could do good and bring my all that I'd learnt there. And he didn't get the funding for it, and I had to wait longer, and I applied for a job on the poverty inquiry, and I was runner-up for that, but Peter Hollingworth asked, who was involved in this other government inquiry into early childhood services, asked Mary Coleman, who was the head of the poverty inquiry, whether there'd been a researcher who she'd recommend, and she recommended me, and so they took me on in this job. So that was the beginning of my career. It hasn't been totally applied. I mean, at the beginning, because I went into that job and then that led on to another job. But I also then, after I'd had some experience, I went back and did a PhD and tutored for a while, and then came out again. In fact, my PhD took 8 years because I kept getting jobs back in various government positions and Melbourne City Council and the Health Department and so on. And so I ricocheted backwards and forwards, and then I was out for in applied work for a very long time, and then eventually, with everything I'd learned, I brought it back into the university to try and establish a program to teach the kind of approach to applied research and evaluation that I developed. So I probably spent about 3/4 of my career in applied settings directly, and about 1/4 of it in academic settings. And then how to tell you about this last, we're talking about 42 years here, Zuleyka. I thought about it and started counting, and I got to about 3,500 organisations, groups and projects. And I thought, how can I tell the story of what I've done? And so I went to my CV, and it's 63 pages of detail. So I thought I would just try and tell a bit of a story about my sort of what I call the early career in the 70s and early 80s, when we were very much researchers. The research, I've theorised about this as the era of research, and I spent a lot of time then in government and child and family services and community-based services and so on. And then my mid-career sort of was from the late 80s and 90s, when evaluation to some extent didn't replace research. We used research methods to do evaluation, but an era of evaluation came. And I again worked in these sorts of areas, but also in community health and disability services and so on. And then after that, I was, and researchers had started to become consultants, and I did a lot of consultancy in the 90s, and some long-term projects in mental health, and a number of projects in hospitals. And the first project, which was that government inquiry into children's services, and I was appointed as a research sociologist. I was the first research sociologist in the Victorian government, in the health department at that time, and I did a huge, I can't believe how much I did. You had to summarise all the submissions, hundreds of submissions to this inquiry. I sat through every one of the committee's meetings and all the discussions and the theoretical discussions and what would be called evidence-based discussions now. I did a survey of every local government area in Victoria, what they were doing in early childhood services and child and family and childcare and infant welfare and kinders and so on. I did a statistically significant survey of a couple of thousand parents throughout Victoria, and rushed around all over Victoria and had people working, doing interviews as well as the questionnaires. And anyway, it was a huge amount of work. And when I think about what I used, I just slipped into it. I mean, this is what speaks for our fantastic classical sociology education. I just used all my data gathering expertise, my surveying and interviewing and all the traditional things. And, you know, I was busy training up research assistants and had to start to learn how to work with a team of people. And then the theories that I was drawing on, you know, the health department had me teaching sociology of the family and sociology, introduction to sociology and so on, to school doctors and school nurses and infant welfare sisters. I can't believe it. The department really then saw the value of sociology and people having these broader perspectives on how the world worked. But I was also using the theories of change and so on to fuel the ways that we were understanding what we were doing and developing models of services and integrated models of services and seeing how things connected and all of that. And then the politics of it. I began to develop thinking about politics of social research and how the power operated. I tell the story about how this government inquiry, I couldn't help but notice that they drafted their report before they received my research results. I thought about that for a very long time. How did they know what they knew? How had they already formed the questions that I took out to the field and so on? So that began a lot of thinking about all of that. And then after that long piece of work and some other work in similar areas in early childhood services and special services for people in a lot of trouble coming to particular centres and so on, I worked out in a large local government area trialling the pilot package of services that had been recommended from this government inquiry. So here was the chance to move from policy to practice and research that practice and evaluate that practice. 3 years work with a one-line job description to assess and evaluate the services provided as to whether they were meeting community needs. And I said, but we haven't done a study of the community needs. So I went out and began there with asking the local parents. I mean, we had a general model, but was it going to work here? And did the people what did they want here? And this was a chance to really fill it out. And then as the services and the professionals and the practitioners and funds started to flow and people were employed, this was how to get a living kind of service developing. So we developed developmental evaluation. We didn't have that term for it, but that was what we were doing. So this was moving from a very helicopter view, statewide policy in view of the national policy, because the money was coming from the new Commonwealth money, to right up close and personal to kitchen table conversations, which is where I coined that method, talking with parents and in their homes and in their kindergartens and parent groups and with infant welfare sisters and the childcare centres and so on. So in-depth community study followed by services evaluation. So what was I using in terms of my sociology here? All those previous skills, standard research and interviewing, more group interviewing now came into the process because people were in their lived experience in their actual lives and worlds. So you needed to work with people as they were in their neighbourhoods, their street level, the services, skills that again, we were inventing this. It came to be called community development, but we were looking at how a community found out about itself and what it needed and wanted, and models of participation and how this was part of research, and the inquiry processes themselves required this. I was pleased for my Chicago School classical sociological studies, but here I actually was trying it out in practice, and critical theory fueled a lot of this, but again, it was being made practical in the actual doing of it. So that kind of classic thing about making the road by doing it. This led ultimately to the thinking about how to actually respond to who it was all for. Mm-hmm. I coined the term critical reference group. using reference group theory from sociology. Well, in sociology, we know reference group theory means actually the group to whom you refer that can help co-construct your worldview, your way of being in the world. And professionals interpreted that as a panel, as to refer to. I've now, in this last book, talked about critical inquiry group, because that's really what I was on about, that this was the critical group, this was who it was all for. And so my big learning was that it wasn't just me researching people's views and what should be done. Everybody was researching it, everybody was inquiring, both with me in these processes and for themselves. All the professionals, they are all asking questions about what am I doing, what's it most, is it doing a good job, and who's it for, and what do they think, and then the people themselves, what do we want, what is my life like, does this service help me, how does it help me, what do I really want, what would be a better service, and so on. So this became the focus of my work. I began working with the service users of acute psychiatric services. They were interested in how to make changes to the services that they were experiencing iatrogenesis from. Again, from sociology literature, the idea that the services are actually doing damage by the ways that they were interacting with the people coming to use them. And this, in a way, was a magnification of what I'd seen elsewhere. And we began this piece of work in a very small way about how could we get feedback from patients into the hospital system. And a very small project then led to a very large, long systems project. It was about a sequence of 10 years of work involving clients, consumers, patients, inpatients, former patients, consumers, who called themselves consumers as a way of trying to get more power over saying what they would want and what was hurting and not hurting, what was feeding them with life and helpful and so on. And this again was drawing on the same kinds of methods and theories and so on, but now we were developing new methods and techniques in this area of what later was more called participatory action research, participatory inquiry processes, but also using dialogue. So not just one group inquiring, but one group inquiring with other group, with the professionals, and this very powerful dialogic approach between the two, where people would speak and then swap the data, see what each other was saying, and build up new ways of thinking. So I again was drawing on lots of sociological thinking about change and conflict, but in some ways I was now needing to seek new and other insights into these, because it was taking me right into the area of human emotion and the operation of emotion and fears and anxieties and violence, and sociology stopped at that point. We hadn't come to the sociology of emotion, that actually came a little later. And I found my way, actually from a fellow sociologist, Patricia Morrigan was using some psychological theories from Jung in her work in organisational change. Well, this was all about organisational change and culture change. So through her and another sociologist, Peter Geyer, I came into contact with this body of knowledge, and that proved tremendously valuable. And while we did this work, I was reconnecting with psychodynamic theories and so on that had some connections with sociology originally, but some of that, the difference between Freud and Jung. Jung was a much more, not a pathological approach to systems. I found it very, very non-pathologizing. They were just human reactivity, and then it was connecting up with some of the systems thinking and organisational change and development. There were sociologists there, people like Gareth Morgan, working with images of organisation, those kinds of metaphors. We're using, the same kinds of things that we were coming up with. We were using language that was biological in nature. We'd be talking about the great octopus of a project, or the bear that had two sides, a warm cuddly side and then a violent side it would turn, and shadow. And so we were starting to move across different disciplines. And so really at that point, I felt like I almost had to leave home from sociology to go off into these other areas. And then I returned to sociology, kind of bearing aloft these new ways of systems thinking, the new physics and so on. And there are parts of this, some of this is coming through into sociology, but sociology has got such sophistication, in my view, that if it re-embraces these theories, I think it could really take off again and become a very popular discipline again. I produced an integrated model of early childhood development services that lasted and was still being used in local governments for over 20 years, and I knew that people from the municipal association were still using these models to inform their ways of being and doing. Integration of multiple nursing streams, I know that work lasted a long time. Out of all the health work, a group of people who were also researchers in other areas came together and co-founded the Health Issues Centre, and that's still going absolutely strongly with theories about how consumers and health and so on, and input of those perspectives. Co-founded the Australian Women's Health Network, that came out of work that we'd done in the women's health area, and models of feminist research, how to do that work's all still publicly available and being drawn on. I did work in the area of deinstitutionalisation with big disability organisations. In fact, that was the work that began my second book, that early work that I talked about in the early childhood area, and Knox was the beginning of my book called Do It Yourself Social Research. And those books, Everyday Evaluation on the Run, that came out of the deinstitutionalisation, and all based on all my experience, but those they were explicitly to try and demystify research and evaluation for all sorts of health and human services and community services and neighbourhood houses, and all the people that were using, on what needing to use and being asked to use and being required to use research and evaluation to talk about and show the value of their work. And I know that they were useful because they became Australia's best-selling texts in research and evaluation. They sold 58,000 copies plus, so, and I know they go on being used. It's still, it's just gone into its third edition, so I think that went on having an impact and contributing. And that large last area of work developed a new category of worker in the mental health services that were consumers employed as staff, as consumer consultants. And their work was to bridge the gap between consumers and the professionals, and to keep open the inquiring between each and the feedback systems in order to keep changing and improving quality of services. And then, to my utter delight, that model got picked up elsewhere in other areas, in local government, and peer consultants and all sorts of people started to develop in youth and other areas as well. So in an absolute nutshell, this book's about this. The subtitle is actually probably more important than the main title, which is Building in Research and Evaluation, Human Inquiry for Living Systems. It's the thesis that inquiring is the dynamic of all living systems. And then writ large, these inquiring individuals together as couples or small groups or organisations, communities, families, large institutions, nation states and globally. The book tries to bring all that together, and then it illustrates them with 10 exemplars in every area of health, welfare, community services, Indigenous, or every area. I wanted to be able to show that they apply in everywhere. Long-term projects that I've worked with, applying these processes to achieve change and more living systems, and showing how they apply to health and human services.